Welcome to Adapt in Class. Answering questions on mental health concept, psych nursing can be very challenging. Psychosocial integrity. Take a ride with me. System questions. I'm going to give you a concept, write it down, and use it as a framework when you see any psych question. First question. All the questions are select or apply. Nurse is caring for a client with history of substance use disorder. The client is demonstrating the defense mechanism of projection. Which of the following statements should the nurse document as an evidence of projection? Select or apply. All the questions are SATA. The staff here are always judging me. I only drink because my friends pressure me. My friend is the one with the problem, not me. I get angry because people keep making me upset. I know I have a problem with alcohol. Everyone else here lies all the time. What do you think? Pause the video, answer the question. After you pick your answer, this is the way you should approach it. Which of the following, what is the question, should the nurse document as evidence of what? Projection. Write the definition of projection. All it means is you, not me. Whatever I do, I project it on you. What is the problem? A nurse is caring for a client with substance use disorder. It can be anything, cocaine, alcohol, whatever. The client is demonstrating what? Projection. Is you, not me. Whatever I do is you. Look at each answer choice and see what it means. The staff here are always judging me. You said they are judging him, not him judging them. Projection. I only drink because my friends pressure me. That is rationalization. It's making reason why you drink. My family is the one with the problem, not me. That's projection. You, not me. I get hungry because people keep making me upset. That's not projection, right? Giving you reason why you get hungry or mad. I know I have a problem with alcohol. That means internalization. You know he has a problem, but that does not mean projection. Everyone else here lies all the time. Everyone, but not me. Projection. How many answer choice you pick? If you over-select, you lose a point. It's a select or apply. A, C, and F all indicate projection in this situation. Once again, keep track of your record and know how to answer them. And this is the reason. It is me, it's not me, but you. You are the problem. And you keep on going through each steps. And this is how you answer questions on this. Same thing. And this is evaluating the progress of a client. Diagnosis what? Obsessive compulsive disorder. Which of the following statement by the client indicate improvement? That means the symptoms has improved. Select or apply. SATA question. I have more control over my thoughts and behavior. I know my thoughts and behavior are normal. I don't have any obsessive thought at all now. I avoid situations that trigger my anxiety. I can delay washing my hands for 10 minutes when I feel the urge. I use deep breathing when I start to feel anxious. Which of this is consistent with the patient who has obsessive compulsive disorder and is proving? Pick your answer, let me know. But this is the way you should approach the question. Go back to the question, break it down. Is a select or apply? Don't over-select. Indicate improvement. I'm doing fine. Obsessive compulsive. Okay. What does that mean? Indicate improvement, heavy defense mechanism. When you say indicate improvement, think about what? Coping. The word coping is number one. Therefore, look at each answer choice and see if they're coping. If they know their problem, is still not coping. I have more control. I have control is coping to the situation. I have control. Control and coping is the same thing. Therefore, if you have control and you coping over my thought and behavior, because that's the issue with obsessive compulsive. I know my thoughts and behavior are not normal. Every obsessive compulsive disorder patient, they know their thoughts are not normal. but they do it anyway. That does not indicate coping or control. It indicates insight of their problem. I don't have an obsessive thought at all right now. It's temporary. The thoughts never go away. This is unrealistic. I will avoid situations that trigger my anxiety, running away from the things that trigger it. You are not coping. I can delay washing my hands for 10 minutes when I feel the urge. That means you're coping and you have control. You know what time you can wash your hand. You know force because of the pressure and the ritual. This is good. I use deep breathing when I start to feel anxious, coping and adjusting to the situation. That means I have control. 3 answer choice. How many did you pick? Did you use the strategy? Yeah. The concept, you have to master them. Know that these are the things that will help you answer the questions really well. Okay, so A, E, and F are the right answer. And this is caring for a client who is concerned about being discharged with a new ileostomy. Which of the following response by the nurse are therapeutic? Therapeutic communication. This is NCLEX practice first. Psych, nursing, mental health, NCLEX questions on what? Psychosocial integrity. You will get used to it over time. Why are you worried about going home with it? Tell me what concerns you most about your ileostomy. Let's review how to care for your ileostomy at home. There's nothing to worry about. Many people live normal lives. I can show you how to empty and manage the patch. This is why mental health, psych nursing feels so hard. All the answers is reasonable, but think about it. It's therapeutic. Therefore, know what you're supposed to say and not want to say. It may look normal, but in medicine, therapeutic communication may be wrong. Pick your answer, let me know. But this is the problem. The patient is going on with ileostomy, and the patient said, I'm concerned. The nurse is caring for a client who is concerned about being discharged with what ileostomy. What do you need to know? Find more information about the situation. How do you find more? You will get used to it over time. That's not finding more. You just force reassurance. Why you worry about going on with it? The why answer choice. Don't pick it. Tell me what concerns you most about your ileostomy. That is, tell me more. Good. Let's review how to care for your ileostomy at home. This is a good answer. Basically, education and helping. This would reduce the anxiety. I will educate you how to take care of it, and that will reduce your anxiety. There's nothing to worry about. Many people live normal lives. I'm not many people. I'm one person. I ask you, I'm worried about it. I can show you how to empty and manage the pouch. This is skills and practical skills. This is also suppresses anxiety. Therefore, these are all therapeutic communication, C and D, and your right answer. What is your score so far? 3 questions. I hope you get 3 out of 3. But these are the strategies. This may be hard, but stop it, answer it on your own as much as you can, and then pay attention to the way I give you the concept. Next time when you see them, is coming and you'll be able to answer it. These are classic on Alzheimer's disease. And this is reinforcing teaching after attending a staff education program on Alzheimer's disease. The next review common assessment findings with their description. For each assessment finding, click to specify the correct description. Each option must be used once. In Alzheimer's disease, these 5 A's you have to know: Anomia, Amnesia, Agnosia, Apraxia, Aphasia. What does that mean? Is the loss of memory, inability to recognize objects or people, lack scale movement, difficulty naming objects, impaired language. Which is which? What do you think? Anomia, the word anomia is name. Anomia, therefore, I can't name object. Amnesia, you know, memory. That's the most common one, loss of memory. Agnosia is the what? Recognized. I cannot recognize object or people that I already know. And apraxia is about movement, so lack of scale movement. And aphasia is impaired language. Know them because that's what they will ask you on Alzheimer's disease. This is also good. Bulimia and anorexia, know the difference. Which of the following findings should the nurse expect? Selected apply. A nurse is assessing a client in a mental health clinic who is suspected having what? Bulimia nervosa. Which of the following findings should the nurse expect? Selected apply. Heart rate of what? 57 beats per minute. BMI of what? 16. What? Calluses on the knuckles. That's Russell sign. Hyperkalemia, dental enamel erosion, and hypothermia. What do you think? This is bulimia, no anorexia. Therefore, what do you expect? Pause, answer the question, keep track of your record. But if I'm answering this question, this is the way I'm approaching it. And I know you pick your answers already. Select or apply. I'm not picking everything. Finding expected on which patient? Bulimia. And I ask myself, what is the definition of bulimia? Their BMI is normal or is too high. Therefore, 16 extreme, this anorexia, not consistent. What is their major problem? Purging, vomiting. So they're more dehydrated. In the process, what happened? They have what? Hypokalemia, no hyper. Because it's hyper, you're going to pick it. Don't pick it. Wrong answer. If you get dehydrated, you get tachycardia, right? That's not bradycardia. They become tachycardia. And anorexia, they have bradycardia because of severe what? Malnutrition. Therefore, this is wrong. They put their hand in their mouth to vomit, purging. So the knuckles is all cut. They cut from their teeth. And so this is what we call Russell sign. This is consistent with bulimia. As the acid comes out, erode the enema. So you have enema erosion. Their temperature is normal because their BMI is normal. They don't have hypothermia. That is anorexia. Therefore, what are your answers? Two answers. Know the difference between these two conditions because they are high yield. Next generation class. Don't worry. Just read it. One question, but you got to read it. Pay attention to the buzzword. And like I said, this is mental health psychology using common sense to answer these NCLEX help questions. And if you need help, this NCLEX channel is designed to help you pass your NCLEX. 7-year-old child brought in by the parent due to the concerns about what? Behavior and school performance. That's your buzzword. Everything should follow. The parents report that the child has difficulty staying seated during class, frequently interrupt others, and is unable to complete homework assignment without constant redirection. The teacher states that the child bursts out answers, even though we don't ask them, does not wait for their turn, and is easily distracted by noises in the classroom. The parent also report that this behavior has been present for over 6 months and occur both at home and at school. The child has no history of developmental delay or intellectual disability. Look at the vitals. Almost normal, slightly tachycardia. But what is the exams? Alert, cooperative, but what? Fidgeting throughout the interview, frequently shifting position and tapping hands on the table, difficulty maintaining eye contact, speech is rapid, occasionally interrupt the nurse. What does they do in school? Struggling academically despite average intelligence, report of incomplete assignment and careless mistakes, difficulty maintaining friendship. What do you think? 7-year-old with a bunch of this problem. You identify something, a bunch of buzzwords, frequently interrupting, answering questions when not called up. He cannot do his homework. What do you think? Which of the following should the nurse include in the client's plan of care? Based on what you're reading, what do you think? Encourage the child to complete tasks in the quiet, low stimulation environment. Allow the child to choose their own daily schedule. Assign long, uninterrupted homework session to build focus. Sit the child near windows to reduce boredom. Use positive reinforcement for desired behavior. What do you think? First, make a diagnosis and know what to do with them. You pick your answer. Pause the video and pick your answer. But I can tell you, this is what attention deficit hyperactive disorder. If this is the problem, then what we're going to do? Encourage the child to complete tasks in the quiet, less stimulating environment. Allow the child to choose their own daily schedule. They can't even pay attention. How can they do that? Assign long, uninterrupted homework session to build focus. That's a trap. The build focus is a trap. You should not assign long. They can't pay attention. Short duration in the structured environment as much as possible. Sit the child near windows to reduce boredom. This is another trap. If they sit near the window, they get distracted. Use positive reinforcement for desired behavior. Yes, whatever behavior you want them to achieve, when you do it, reward them. So those are your right answer. But this, I design it in the next generation NCLEX case form. But you know it, a bunch of information. That's psych. You can figure out the buzzword and you can answer this question easily. Another one. Don't worry. This is grief. What is the problem? NS is providing care for a client experiencing loss. Match each situation with the type of grief. There is different kind of grief. Anticipatory grief, normal, complicated, disenfranchised, delayed grief. You have to know the definition of it. Read all the cases and see which one is which. Number one, a 42-year-old client's spouse died suddenly in a motor vehicle accident 2 weeks ago. The client states, I can't believe this happened. I keep expecting them to walk through the door. The client avoid discussing the funeral arrangement and say the doctor must be wrong. In summary, husband died in an accident, but the spouse is still expecting them to come, not ready to accept the grief and saying that no, the doctor may be wrong. What kind of grief is that? A, which one? What do you think? This is a delayed grief. She's not ready, he or she is not ready to start grieving. That's the problem. A parent whose child died 10 years ago continued to keep the child's room unchanged, cries daily. The parents report inability to perform new relationships and state life stopped the day my child died. 10 years ago, the baby died. Mommy's still grieving. Can't do anything. She has stopped life for herself. That is bad grief. What do you think? Is it normal, complicated, disenfranchised, or anticipatory? This is complicated. Prolonged grief. It's too long. We got to fix it. A client whose partner is diagnosed with advanced Alzheimer's disease state, I feel like I'm already losing them, even though they are still alive. That means grieving before the patient died. I say I'm losing them before even they leave. That is what? You are anticipating that the grief is going to happen, and therefore you have anticipatory grief. A client recently diagnosed with metastatic cancer report intense sadness, anger, insomnia, not showing the grief. The client states, I'm grieving the life I thought I will have, not accepting it publicly. If you do that, that's disenfranchised. And the last one, a client's sibling died 6 months ago. The client has resumed work, so acting normally, participate in social activity, and state, I still miss them, but I go on with my life. I'm learning how to live again. This is a normal grief. Know them, the difference between them, so that when they ask you, you can answer them. And this is caring for a client with borderline personality disorder who state, everyone here is out to get me except you, splitting. Which of the following response should the nurse make? Select or apply. You can trust me. I will always be on your side. Why do you think others are against you? That is not true. No one is against you. Recommend the charge nurse assign the same nurse consistently to this client. I will continue to work with you, and the team will care for you as well. Which one should the nurse respond in the patient who has borderline personality disorder, splitting, saying everybody is out to get me except you, flattering the nurse? What do you think? I can tell you, you can trust me. I can always be on your side. Wrong answer. You are reinforcing the client saying, hey, you are the best. Therefore, more manipulation. Why do you think others are against you? The word why is wrong. Don't ask that. That's not true. You are basically challenging the patient. No one is against you. Wrong answer. Recommend the charge nurse assign the same nurse consistently to the client. This is a trap. If you assign the same nurse, you will continue to say, you are the best, flattering you, and nobody is coming to relieve you. Basically, the patient has one person to harass, and therefore more likely to manipulate one nurse. But if you use different nurses every day, they cannot do that. Therefore, that's a wrong answer. I will continue to work with you. I will come and see you. And the team, other people will also come and see you. You cannot split. Therefore, this is the right answer. This is a hard one. It requires some critical thinking based on the concept. And therefore, next time when you see it, I've given you everything about borderline personality and how to deal with them. And this is assessing a client who has major depressive disorder. Which of the following findings should the nurse suspect? Select or apply. Like Alzheimer's, that has a bunch of A's. This one also has A's. So don't confuse them. Don't mix them together. Anhedonia, apathy, agitation, allogia, anorexia, and agnosia. Remember, all the A's of Alzheimer's doesn't cross over. If you see it, know that it's not part of it. You pick your answer, stop the video, and pick your answer. But I can tell you, number one is the right answer, right? Expected finding depression. They have what? Lack of pleasure. And that is what? Interest. That's anhedonia. Apathy is the motivation, lack of motivation in a depressive patient. They may have psychomotor agitation. Allogia is what? What do you mean? It's a poverty of speech. You don't see it. This is mostly found in what? Schizophrenia. Anorexia, yeah, they will eat a lot, or their appetite, they will lose appetite. Agnosia, able to recognize faces. We saw it in Alzheimer's or neurological problems, not depression. And this is reviewing the medical history of an older adult client admitted for treatment of cocaine use. Which of the following findings are risk factors for late onset substance use disorder? Select or apply. So patient was admitted for what? Cocaine use. How would that affect them for what? Later on substance use disorder. There's certain things that will make them, in addition to being admitted with cocaine use, certain things can affect whether they develop bad stuff in the future. Social isolation, chronic pain requiring opioid, stable financial support and strong family involvement, history of depression, recent retirement, and recent loss of spouse. Which one? Risk factors for late onset substance use. Pause, answer your question, let me know. But I can tell you, number one, when you're alone, bad problem. If you take opioid for chronic pain, that's the worst one. If you have financial support and family is involved, that's protective. Depression will make that worse. You drink and you basically start abusing stuff. Recent retirement is like living alone. And if you lost your spouse, also living alone. These are bad stuff that can make you more vulnerable to have substance use disorder. A charge nurse is observing a nurse assessing a client using professional interpreter. Which of the following action by the nurse require intervention by the charge nurse? So which is appropriate ways using them? Select or apply. The nurse maintain eye contact with the interpreter while asking questions. The nurse asks the interpreter to summarize the client's response. The nurse uses short, simple sentences when speaking. The nurse asks a family member to clarify unclear response. The nurse speaks directly to the client during interaction. When you're using professional interpreter in a hospital, there's specific etiquette that you're supposed to follow. Which one is this? Pick your answer, let me know. There's strappy answers here. If you overselect, you're going to get wrong. Pay attention to the pay attention to the buzzword as you select your answer choice. Look at the answer choice word. There's traps there. Maintain eye contact with the interpreter while asking questions. Wrong answer. Even though the interpreter is there, you stay talking to the patient. Eye contact to the patient. A is wrong. So watch for that. and therefore they need intervention. They said the nurse should intervene. The nurse asks the interpreter to summarize the client's response. An interpreter should not do what? Summarize client's response. They should tell you exactly what the patient said. Intervention. The nurse uses simple, short sentences when speaking. That's great. The nurse asks a family member to clarify unclear response. This is also a trap. You don't understand what the patient is saying or the client is saying, so you try to use the family member. You're not supposed to use family member. That's the idea. You're supposed to go through the interpreter. Therefore, this need intervention. The nurse speak directly to the client during interaction. Yes, to the patient. Interpreter can hear it and he can make assessment of it. So these are ways, etiquette to use professional interpreter. But remember, they said intervene. You're doing the wrong thing. And let's provide care for a client who is now post-electroconvulsion therapy. We use this for what? Depression. Which intervention by the nurse is appropriate? Select apply. Reorient the client. Monitor for retrograde amnesia. Stay with the client. Place the client on their back. Instruct the client about driving safely. Which one should you include? ECT is what? Pause the video, answer your question. I'll give you the rationale and the concept. They are used for refractory depression. And what is that? We're creating seizures in your brain. If I create seizures in your brain, you need to reorient me. It's like you just had seizure. You're going to forget what happened before the seizure. Monitor for retrograde amnesia. You're supposed to stay with me to protect me. You should not put me on my back, on the side because of aspiration. Instruct the client about driving safely. That's a trap. You are not going to be driving. Somebody has to drive you. You can't drive after this procedure because we induce seizures and we give you sedation. So ABC are your right answer. Which of the following actions should the nurse take? Select or apply. Another next generation. A nurse is in the emergency department is caring for a 3-year-old child brought in by the caregiver. The child has multiple bruises in different stages of healing. Scar burn on the arm with a clear demarcation line and the laceration on the scalp that is actively bleeding. This is somebody we think what is happening to the patient. The caregiver explanation is consistent with the injuries. Buzzword, the nurse suspect abuse. This is a kid who's being abused. Read it again, pay attention to the word, and therefore when you see it next time, this is the way they will describe somebody who's being abused. What should the nurse include in a plan of care then? Apply pressure to the bleeding wound, notify the charge nurse and follow facility protocol, question the caregiver in details about the injuries, report the suspected abuse to the Child Protective Service, document subjective findings and the caregiver statement. What do you think? NCLEX practice test, mental health concept, psych nursing. What do you think? We are reviewing the concept, NCLEX review concept on psych nursing. Apply pressure to the bleeding. You still have to provide basic care. Notify the child nurse and follow facility protocol, whatever they want to tell you for a suspected abuse. You should not question the caregiver in details about the injuries. It's unnecessary. Report the suspected abuse to the Child Protective Service. You are allowed to do that. Document subjective finding and caregiver statement. That's a trap. Not subjective, not something you think, not what you think. It's what was there. Objective value, pictures, whatever, speak for themselves. Therefore, that's your right answer. A nurse is caring for a client in alcohol withdrawal. Which intervention should the nurse include in a plan of care? Select or apply. If you're in alcohol withdrawal, should we give you a lorazepam, monitor you for seizures, agitation, keep the environment well lit and then low stimulation, encourage you to take some caffeine to reduce fatigue, and start a low protein diet to protect your liver because you take a bunch of alcohol and you may be in a withdrawal. I can tell you, we got to prevent seizures, so lorazepam. We got to monitor you for seizures, for the withdrawal. And we got to keep low stimulation to keep the circadian rhythm intact. Caffeine will worsen it, and you should not lower protein level. 2 more questions. And this is preparing to provide postmortem care for a deceased client. Which actions are appropriate? Select or apply. Open the client's eyes and mouth gently for drainage. Place the client head in the supine position with the hand at the side. Remove tubes and lines. Cleanse the body and remove soil linens. Remove dentures if available. Apply a clean gown and fresh linen. Allow the family time with the body before transport. What do you think? Which one is appropriate? You should not open their mouth and their eyes. Both of them should be closed. So this is inappropriate. Place the client head in the supine position with the hand on the side. They should be upright. If you put them on this supine, blood pool in their face and more discoloration. Remove tubes and lines. You should not remove it until you're told to do that. So these are concepts that are very important. Cleanse the body and remove soil linen. That's good. Remove dentures. You should not remove it. Keep it. It maintains the shape of the face. Apply a clean gown and gloves. This is perfect. And ask the family, allow the family to be with the patient as much as possible. That's okay. This is all you need. And the last question. This one is my favorite. And this is triaging several clients in the emergency department. Which clients require involuntary psychiatric admission? That means you're doing something wrong. You're going to kill yourself. You're going to kill somebody. Something is bad. You can't take care of yourself. And then we're going to admit you to the hospital. So which patient? A client with major depressive disorder who states there is no turning back. A client with schizophrenia who is responding to command hallucination, telling them to harm others. A client with bipolar disorder who is euphoric, sleeping 3 hours per night and spending large amount of money. A client with severe anxiety who is pacing, hyperventilating, who agreed to treatment. A client with paranoid delusion who believe neighbor are poisoning them and he has to purchase a gun, who you need to see and make sure we put them on psychiatric involuntary admission. A paranoid patient who has a gun is going to shoot somebody. If you have anxiety, you're pacing, hyperventilating, but there's no anything that you can't take care of yourself is good. Same thing, that bipolar disorder, all these things does not tell me they can take care of themselves, or they're suicidal. Schizophrenia with hallucination, you got to find the content. But what? If you find the content, that's the key. You find the content and they tell you you're going to harm somebody. Yeah, we got to figure it out. And the depression patient, he said, I'm not coming back. That's a bad sign. This is adapting class, mental health concept, Psych NCLEX questions, NCLEX practice question, NCLEX practice test, NCLEX review, concept on mental health, psychosocial integrity. Like I said, use the framework to answer these kind of questions. The video that will come in is what? Psychosocial pharmacology, psych pharmacology. You also have to know both to master it. Take care of yourself. Video help you. Share with your friends. Subscribe for more content and a little bit of a comment so that the video may reach those who need it. Take care of yourself and bye.